At Chamberlain, we know transitioning from RN to NP takes more than just knowledge. It takes hands-on experience. And as the #1 largest MSN program, we know how to help you get there. That's why we created our unique Immersion Skills event, a 2-day in-person experience held right before your practicum. It's your chance to practice essential clinical skills in a supportive environment, so you can step into your first day of clinicals with confidence.
The benefit of immersion experience is navigating into a provider role. It takes skill and critical thinking. And so we have stations here that are designed to expose our students to common practices that they may see in the practicum setting.
We have simulated models, and they're able to actually go in and learn how to do a clinical breast exam. And it just gives them that opportunity to say, yeah, I'm ready, I can do this.
The Immersion Skills event was great. We learned how to do prostate exams. We learned how to do pap smears, collecting cells and samples. We learned about looking at rashes and how to do orthopedic exams. I love the hands-on aspect of it. I felt like we did get to learn a lot of new skills.
The skill stuff prefers you just so that when you go out there, you're able to say, okay, I've done this before, I've done a rectal exam before, or I've done the pap smear before, because you have the equipment there to practice. It helps a lot.
We learned how to do actual assessments on mannequins, which you wouldn't get anywhere else unless it was in person, or clinical. But it just helped with my confidence going into clinical to have those skills on hand.
During our skin assessment, we learned different types of skin issues, and then in our gynecology, urology, we learned how to do pelvic exams and what abnormalities we should be looking for during those.
They gave us examples of a 12-lead EKG of patients, and then depending on what those EKG shows, we would do our differential diagnosis. So what would you diagnose this patient with after you see that EKG, and then what treatment would you be expected to order for this patient?
The immersion weekend was phenomenal. We learned how to do exams, physicals prior to leaving. We learned suturing skills to get us ready, so when we were in these urgent care clinics or places that we might have the opportunity to do that, we were prepared by the time we got there.
When they first come in, we're not teaching you to be experts today. What we want to do is introduce you to the concept of these exams to get you comfortable. We want the students to be prepared. We want to give them enough so that when they walk in there, they're ready. It's just giving them a certain level of confidence and competence in the techniques.
Another benefit of coming to the immersion skill event is that students have the opportunity to build lifelong relationships with their peers, their students, the faculty, the immersion faculty. We're all advanced practice nurses, and we're here to answer their questions. We're here to support them on their journey.
This is more than just practice. It's preparation for your future. You've got this, and we've got you.